Hello, here in lesson 2 on joints, we will look at movements that occur at synovial joints, as well as a classification of synovial joints. We'll look at factors such as range of motion and the effects of aging on the joints. Specific terminology is used by healthcare professionals, including anatomists, physical therapists, and kinesiologists, those who study the science of human movement, to designate the movements that occur at joints. So on this slide, we will look at types of movements that occur at synovial joints that are grouped into 4 main categories. Gliding movements involve relatively flat bone surfaces moving back and forth and side to side against each other. This is the type of movement that happens between the carpals at the intercarpal joints, similarly at the intertarsal joints. Then we have angular movements. With angular movements, there is an increase or a decrease in the angle between the articulating bones. This includes the specific movements of flexion and extension, as well as adduction and abduction, which we will describe in a few slides. Rotational movements involve a bone revolving around its own longitudinal axis. So think about rotating on an axis. And then we have a list of special movements. So again, gliding is a simple back and forth movement where there's no significant alteration of the angle between the bones. This results in a limited range of motion, even though the joints are synovial and technically are freely moving. And again, we find this in the intercarpal joints as these bones slide against each other and allow for waving and flexion at the wrist. Let's move on. Flexion and extension are opposite movements. In flexion, the bones are coming towards each other and there is a decrease in the angle at the joint. So think of bending when you think of flexion. We bend forward at the trunk. Flexion is also occurring when the head is bent towards the chest, or you can think about bending the elbows and the knees. Also note that flexion involves raising the entire upper limb anteriorly and then superiorly, as in raising your hand to ask a question in class. That is also flexion. At the shoulder, or flexion of the upper limb. Extension is the opposite motion. It increases the angle between the articulating bones. The bones move away from each other. So extension occurs when one straightens up at the waist, or when one extends or kicks out at the knee, or one extends their arm at the elbow. At the shoulder, extension is when one lowers their arm back towards the side of the body. Lateral flexion is a movement of the trunk or the head towards the side, either right or the left. Hyperextension is a continuation of extension beyond the normal extension or beyond the original point. So for example, one would be flexed at the waist when they're taking a bow. As one straightens up, that is extension. And then if someone was to bend backwards at the waist, that would be hyperextension. We can also hyperextend at the neck when we look up to the sky. Where else can we hyperextend? Cannot hyperextend at the elbow or the knee. Those joints are limited in the amount of extension. The last joint that I will describe where hyperextension occurs is at the shoulder. So recall that lifting the hands anteriorly and then superiorly is flexion at the shoulder. To lower the arms back down, okay, so inferiorly and then posteriorly, that is extension. And then to pull the arms or the upper limbs backwards as if you were getting ready to run or take a dive, that is hyperextension at the shoulder or hyperextension of the upper limb. So here we have some diagrams of these type of movements. Flexion and extension, hyperextension occur at the neck, at the atlanto-occipital joint, as well as the cervical intervertebral joints. We have flexion at the shoulder again, that's the weird one, where the arm is brought up, and then extension is to lower the arm towards the side, and hyperextension is to pull the arm, and I should say upper limb, behind you. We also have flexion extension at the elbow. That occurs in the opposite direction at the knee. So we flex when the leg pulls up towards the buttocks, and extension at the knee occurs when one kicks out or forward. I didn't mention the hip joint, but that's another joint at which flexion, extension, and hyperextension can occur. So flexion at the hip is when the lower limb is brought up towards the trunk. Extension is to lower the leg back down posteriorly so that it's in the standing position, and a hyperextension is to bring the lower limb behind you towards the buttocks. And the last diagram there in G is lateral flexion that occurs at the waist, that can also occur at the neck. Another pair of angular movements are abduction and adduction. So the names are similar. I'll give you a way to remember them. Abduction involves movement of a bone away from the midline. So think of moving the arms out towards the side as if you're spreading your wings. In the lower limb, abduction is moving the leg away from the midline toward the side as well. You can also abduct at the fingers. So to spread the fingers apart is abduction. The opposite is adduction, or pulling it back. Adduction moves the bone toward the midline. So jumping jacks, if you're familiar with that exercise, is a combination of abduction and then adduction. Abduction, adduction. When something is abducted, it is taken away. So think of abducted when you think abduction and moving away from the midline. Adduction is to put it back together, add it. So that's to move these limbs and these bones toward the midline. All right, so there's ab and adduction. It occurs at the wrists, at the hip, and also between the fingers, specifically at the metacarpophalangeal joints. Another angular movement is circumduction, and this is movement through several angles where the body part is moved in a circle. So think about creating a circle in space with your upper limb as they are extended, or making a circle in space with your lower limb as it is slightly extended or abducted. Rotation is another type of movement that can occur at synovial joints. During rotation, a bone revolves around its own longitudinal axis. So think about a bone moving around a central point. This occurs when we indicate no by rotating our head from side to side. That movement is actually allowed by the rotation of the atlas around the axis. Remember C1 and C2 vertebrae at the atlantoaxial joint. We can have rotation in the waist. You can also have rotation at the shoulder and at the hip joint. So with lateral rotation, the arm is rotated outward or laterally, and medial rotation is when the shoulder is rotated inwardly, as if to cross your hand across your chest. Similarly with the hip joint, it is best illustrated when the elbow or the knee are flexed. We have several special movements that include changes in angle. Let's go through them quickly. Elevation is an upward movement of a body part, such as closing the mouth. The opposite movement is depression, where the body part is moved inferiorly. So if you think about raising and lowering the jaw, that is elevation versus depression. Also occurring at the jaw is protraction and retraction. Protraction is to move a body part anteriorly, as in to stick out one's chin, while retraction is to pull it back towards the normal position. These movements are illustrated on this slide. So elevation raises the jaw, depression lowers the jaw, protraction sticks the mandible or the chin forward, where retraction pulls it back to the normal position. Also shown on this slide are the angular movements that occur at the ankle. Lateral rotation is called eversion, and a medial rotation is called inversion. Some individuals have permanent inversions or eversions in their feet. You can see this if you observe them from the back and look at the wear or the angle of their shoes, okay? Especially if they're wearing ugly Uggs or those other types of boots or shoes that have very little ankle support. Now, flexion and extension at the ankle, so moving the foot up towards the sky or down towards the ground, those have special names. To point the toes upward and decrease the angle at the ankle is called dorsiflexion. To lower the foot down and point the toes toward the ground, that is called plantar flexion, or to plant the foot down. So technically, plantar flexion is extension at the angle. We've talked about supination, where the palms are rotated upward so that they can hold a cup of soup, while pronation is to rotate the palms posteriorly. And humans are special because we have opposable thumbs. So because of the special angle at the pollex, the thumb can touch each of the individual digits. That's called opposition. All right, so again, inversion is to rotate the foot medially, and eversion is to rotate the sole laterally. Dorsiflexion decreases the angle, pointing the toes upward, and plantar flexion lowers the toes to point them toward the ground. Supination, turn the palms upward. Pronation, turn the palms downward or posteriorly. And then opposition again is moving the thumb across the palm to touch the tips of the fingers on the same hand. Here's a summary table of the various movements that occur at synovial joints. All right, so we just looked at the types of movements that can occur at synovial joints. Now we are going to classify synovial joints based on specific types of movements, which is really classification based on the shape of the joint, if you want to think of it that way. So there are planar synovial joints, hinge joints, pivot joints, condyloid joints, saddle joints, and ball and socket joints, and these allow the various movements that we saw in the previous slide. So we're going to put it together. So let's look at the specifics of the synovial joints classified by movements. Planar joints permit back and forth and side-to-side movements. If you recall, that is a gliding motion. So planar joints include the intercarpal joints as well as the intertarsal joints as seen in the diagram below on the left. And planar joints, because they allow movement in two directions, back and forth or side to side, are called biaxial joints, or they're classified as biaxial joints. Hinge joints produce an opening and closing motion like that of a hinged door, so they only allow for flexion and extension, and this occurs at the knee joint and the elbow joint, also the interphalangeal joints. Because they only allow movement in one direction, they are uniaxial joints. Pivot joints involve the surface or projection of one bone fitting into a ring or a ligament of another bone. And this allows that one bone to rotate along its longitudinal axis. Pivot joints are uniaxial in that they only allow for rotation. An example is given here on the bottom left diagram, where the head of the radius fits into the annular ligament of the ulna, allowing the radius to rotate on its longitudinal axis. This is responsible for supination and pronation of the forearm. We have a similar joint between C1 and C2, or the atlantoaxial joint in the neck. So if you recall that the dens, or the process of C2, the axis, fits into the ring created by the absence of the body in the atlas. And this is what allows us to rotate our heads laterally and medially to indicate no. And remember, no means no. Moving on to condyloid joints. In a condyloid joint, the projection of one bone fits into a shallow oval-shaped depression of another bone. An example of a condyloid is the radiocarpal joint at the wrist. So you can see that the somewhat rounded surfaces of the scaphoid and lunate fit into the depression of the radius and allow for biaxial movement, both flexion and extension, as well as adduction and abduction. And it also allows for a little bit of circumduction as the bones move through the various angles. Another example of a condyloid joint are those found between the metacarpals and the phalanges at the knuckles. Okay, so if you stick one finger up in the air, you'll see that it can flex and extend, it can abduct and adduct, and you can also make a circle in space with that finger, that circumduction. It's a different joint at the thumb, so the condyloids are between digits 2, 3, 4, and 5, but at the thumb, we have a different joint, which is described on the next slide. As we mentioned on the previous slide, the joint between the trapezium carpal bone and the metacarpal of the thumb is a unique joint. It's called a saddle joint, and it's so named because the saddle shape of one bone fits the articulating surface of another bone as if a rider were sitting in a saddle and straddling it. The saddle joints allow the same types of movements as condyloid joints, so they are biaxial, allowing for flexion, extension, abduction, adduction, and some circumduction. So you can wiggle your thumb and make a circle in space. This is also what allows for opposition at the thumb. Finally, we have the ball and socket joints. These are similar to condyloid joints in that the process or projection of one bone fits into a depression in another bone, but that depression tends to be deeper and cup-like with a ball and socket joint. Your classic examples of ball and socket joints are the shoulder and hip joint, so the glenohumeral joint and the femoral acetabulum joint. These joints are multi-axial or triaxial because they permit movements around 3 axes. They allow for flexion, extension, abduction, adduction, and properly rotation. In this case, they also allow for circumduction, obviously, because it can move through all the angles. Now, the shoulder joint has a more shallow depression, the glenoid cavity, compared to the acetabulum of the hip bone. So the head of the femur fits more deeply into the acetabulum of the hip, and that joint is more stable but allows a smaller degree of movement compared to the shoulder joint where the fit is not so tight but you have more flexibility. That also means that the shoulder joint is more susceptible to injury and dislocation. Here we have a great table that summarizes the structural and functional classifications of the joints. So it puts it all together with respect to the movement at the joints, the shape of the synovial joints, as well as examples. So please study this. All right, we're finishing up this unit. Let's consider factors that affect range of motion. So range of motion, often abbreviated ROM, refers to the range through which the bones of a joint can be moved, and the range of motion is measured in degrees of a circle. Factors that contribute to keeping the surfaces in contact with each other and therefore affect the range of motion include the following. Number one, we have the structure or shape of the articulating bones. So the shape of the bones, how they come into contact with each other, will determine how closely they fit and what type of motions they allow. For example, we saw that with planar joints, only gliding motion is allowed because these surfaces are flat and just move against each other. Whereas at a ball and socket joint, because of the shape of the articulating surfaces, there's a greater range of motion that is allowed at that type of joint. Number 2, strength and tension of the joint ligaments. Ligaments play a major role in determining the types of motions that are allowed at joints. We looked at that knee joint. Did you see all those ligaments? They definitely hold the bones together, but they also limit the type of motion that can occur at that joint. Ligaments are also tense when the joint is in a certain position. So if you're talking about extension versus flexion, that changes the tension within the ligaments. Tense ligaments restrict the range of motion. So practices such as warming up and slowly stretching those ligaments is helpful to prevent injury once more vigorous or rigorous activities are assumed. Warming up also literally warms up the synovial fluid in the joint cavities. In doing so, the synovial fluid becomes less viscous and acts as a better lubricant. A third factor to consider, which affects contact and range of motion at synovial joints, is the arrangement and tension of the muscles. So muscles create motion by attaching to two or more bones at a joint. So muscles always span a joint, and when tension is generated and transmitted to the bones via the tendons, one bone is always pulled toward another. So muscle tension reinforces the restraint placed on a joint by its ligaments and can restrict movement. Fourthly, consider contact of soft parts. So the point at which one body surface contacts another may limit mobility. For example, if one is flexing at the elbow and pulling the forearm toward the shoulder, it can only flex to a certain degree once the muscles of the forearm come into contact with the bicep brachii and muscles of the arm. So the presence of soft tissue, including adipose tissue, may limit the range of motion at a joint. A fifth factor to consider are hormones. Certain hormones affect the flexibility of joints. For example, the hormone relaxin increases the flexibility of the pubic symphysis as well as loosening the ligaments between the joints throughout the body, including the synovial joint between the coxal bones and the sacrum toward the end of pregnancy. And this allows for accommodation of the shift in the center of gravity as the uterus grows. It also allows for widening of the pelvic outlet during delivery. It also contributes to the lordosis and sometimes the clumsiness that pregnant women experience. Next, we have disuse. You know that. If you don't work out, if you don't stretch, it limits and restricts joints and can lead to injury. You also have to consider that muscles that are not used tend to atrophy and can put more restriction on a joint. Let's conclude by looking at how aging affects the joints. Now you know that one of the major complaints of the older adult is pains and aches and decreased range of motion in the joints. For one, aging may result in decreased production of synovial fluid, so that results in a loss of lubrication and shock absorption at the joints, as well as decreased nourishment of the cartilage. So the cartilage becomes thinner and less protection and shock absorption are provided. The ligaments shorten and lose some of their flexibility as we age, especially if we do not maintain range of motion activities and exercises. Osteoarthritis is a type of arthritis or inflammation at the joints that is partially age-related. It is also related to excessive stress on the joints, or wear and tear, as was formerly called, and not only occurs with aging, but increased physical activity or increased weight bearing. So athletes can develop osteoarthritis earlier in life, as well as those that are overweight. Osteoarthritis tends to take place in the weight-bearing joints or the joints that are experiencing overuse. With osteoarthritis, there's a breakdown of the cartilage and overproduction of bone tissue causing bone spurs, and then the bone tissue begins to rub against each other and causes these creaking sounds, and it is painful. Osteoarthritis. So how do we prevent some of this? Stretching and aerobic exercises are helpful in minimizing the effects of aging, as stretching and exercise helps to maintain the effective functioning of the ligaments, the tendons, and the muscles, keeps the muscles and the bones strong, keeps the ligaments and tendons loose, improves the production of synovial fluid, and helps to maintain the articular cartilage. These last 3 slides are just diagrams of selected joints of the body so that you can visualize some of the structures that we have discussed. So don't learn these, don't memorize these, just become familiar with some of the structures that we have discussed. So here we have the ball and socket shoulder joint. Note things like tendon sheaths and bursa. Okay, we talked about the acromion and the coracoid process, the glenoid cavity, for example. Here at the elbow joint, we have a hinge joint. Look at all those ligaments that wrap around this joint. Okay, and the olecranon bursa that protects the point of the elbow and lies under the muscle tendons that would span this joint. And I like these diagrams of the knee because they hopefully show you the arrangement of muscles around the joints. So now that we've looked at the skeletal system and we've looked at articulations, the next thing to add are the muscles that attach to these bones, spanning the joints and causing movement. And that's it for this unit.